Welcome to Let's Thrive Postpartum.
Hi, and welcome back to Let's Thrive Postpartum. I'm Kelly.
And I'm Ashley.
And today we are so excited to introduce you to Tatianna Graham. She is going to talk to us about your inner core and your body postpartum. So, Tatianna Graham is a mind body health coach, and she has a background in physiotherapy, yoga, and mindfulness. Her true passion is preventative health, and she has over 12 years of experience helping women overcome chronic pain, heal pre and postnatal dysfunctions, and truly heal within by guiding them in establishing a strong mind body connection through breath, inner core, and more. The results tend to be lifelong, and her clients get to live their lives in the best versions of themselves. Tatianna is committed to sharing her passion online through her program, the Move with Ease Method, and she is also a regular expert within the Thrive Postpartum platform.
You guys are really going to love this chat. So, you're going to hear about how our cores are impacted through pregnancy and postpartum and different ways to rebuild that strength. We're also going to do 2 visualizations so you can at home learn how to strengthen your own core and maybe even reduce the number of times that you have to cross your legs when you sneeze. Moms out there, you know what I'm talking about. We think you guys are really going to like this one.
Welcome, Tatianna. We are so glad to have you here today.
Thanks
You
for
so
joining
much.
us.
So excited to be here.
We're going to have a really great conversation. And we met through kind of a social media platform, and I have taken some of your workshops and am a huge fan. So thank you for talking to us today about your core and what you can do to really support your core postpartum. So before we jump in, Tatianna, could you tell us just a little bit about yourself, how you got into physiotherapy, and really why you have focused your career on supporting women?
Yeah, absolutely. So, again, thank you so much, ladies, for having me here. I think what you guys are doing is amazing, something that, all moms need and crave, and it's just so overdue. So, congratulations on launching Thrive, this
Thank you.
podcast. It'll be so good for all the moms out there. So, I started physiotherapy because I had an injury in university. Just a running injury. I have like sort of flatter feet, and I was wearing really old running shoes. And the doctor found through a bone scan fractures in my tibias, my lower legs, and just said you should go to see physio. And I was like, "What's a physio?" And so when I realized you could have a job in teaching people how to move, like exercise, I thought that was super cool. So that's how I got into physiotherapy. And then just fast forward as I grew as a practitioner, I started to do yoga in the community, then fell in love with that practice. As my body was changing with pregnancy, I couldn't run as much. Things were heavy, so found yoga physically. And then as I dove deeper into yoga personally, did my yoga teacher training, and then it just complemented my physiotherapy practice. So started introducing that with my clients, and then just really connecting with women because I'm a mom, I am a woman that's transitioning through my 30s, my 40s, right? And with the breath work that is involved with yoga, the mind-body connection, and the changes that happen mostly to your core, other parts of your body too, but a lot of your core, obviously, when you're pregnant, that was where I found it really rewarding to help other moms reconnect and discover even that they have this, not just your six pack, but an inner core, which we will talk about today.
That's wonderful. Could you walk people through, and us too, Kelly, I know you've got some experience. I am so excited to learn more about this. Could you, I guess, give a little context to like what kind of changes, for all the pregnant moms out there that might be listening or people that have just had a baby, like what is going on in their core that changes that is kind of needing to be, I guess the way I thought about it myself, kind of put back together in a sense.
I think that the best way we can do this is to do a visualization exercise. And then from there, I'm going to explain what happens to those parts as you become pregnant, as you go through labor, whether it's a C-section or you're vaginally delivering, and then what happens after. But first, let's all close our eyes, whether you're pregnant or not, doesn't matter. We're going to put one hand on our heart and one hand on our belly. And I always teach this with eyes closed. So you're welcome to close down your eyes. It just gives you a little bit more focus inward. And as you breathe, try to breathe smoothly and calmly. And as you breathe, feeling your belly rise under your hand, followed by your rib cage expanding, and then your chest puffs. And then as you exhale, your chest softens, your rib cages come down and in, and then your belly softens. If you don't feel that, don't worry, but try to encourage that 3-part breath if you can. And as I describe your body, your core to you, I want you to really visualize it. There's so much power in mind-body connection, and visualization is a great way to do that. So when we talk about core, most people think about the 6-pack, right? Pretend we took that off your body, okay? We just peeled it away for a second. The next 2 layers are called your obliques, external and internal obliques. We're going to peel those away too. So if you count, we've come to the 4th layer, right? And this 4th layer is called your transversus abdominis. I like to tell my clients to think of a corset. This corset muscle is 4 layers deep, and it goes roughly from your lower rib cage to the top of your hip bone, and it wraps around your center just like a corset would. Okay, it's a very big, expansive, deep muscle. And it inserts onto your spine, the deepest part of your spine called multifidi. Now, multifidi are a small set of spinal postural muscles. You don't need to know exactly, but just know that they run from tailbone to the back of your head. And when the corset is inserted onto multifidi, what this means is they work together synergistically. So if your corset is firing properly, multifidi fire properly, and multifidi keep your spine in this nice posture, okay? That's the middle part of your core, deep core. And then you've got top and bottom. So the top part of your core is your diaphragm. So if you picture your rib cage, it's 3D, right? So under your rib cage, there's this dome-shaped structure called your diaphragm. And then on the bottom things, like if you think about your pelvis, the bones of your pelvis looks like a bowl, and the bottom of your bowl is not empty. You've got pelvic floor muscles. For short, we're going to call it front and back. Okay, so the front holds your bladder and the back holds your bowel. Okay, just for short. So when we breathe in, air is coming into your lungs. What happens when your air is filling your lungs? It's going to push your diaphragm down. So imagine a dome-shaped diaphragm is going to get pushed down, sort of like a trampoline shape now, right? That's the inhale. And then as that diaphragm's doing that, because your belly, your contents, organs have to go somewhere, they're going to go out a little bit and down. So the corset's going to expand or relax. So the inhale, your corset's expanding, diaphragm's coming down. Abdominal contents, the organs, also shift down just a touch. So your pelvic floor, the bottom of the bowl and the pelvis, it's also going to relax and open or drop down. It's kind of like someone sat in a hammock. That's the inhale. And then as you exhale, the opposite happens. Maybe not a ton, but just like 5%, because as you exhale, air is exiting your lungs. Your diaphragm's going to dome back up. Your rib cages have space to come down and in. Corset's going to cinch your waist a little bit. And then your pelvic floor muscles have less pressure on them because you're exhaling. So it might feel like a little bit of a lift. Now, I just talked through that super fast. Sometimes it takes like 3-4 sessions to connect with those parts. But let me know, how did that go?
It sounds
I
good.
I was going to say, I really love the description and the visualization. I I can perfectly kind of, I don't know, just imagine how all those shapes are like moving and shifting and just bringing like awareness to it. You kind of being able to walk through gives me a really good idea of like what's kind of going on in there.
Amazing.
Me too. And I feel like it's the opposite. So in my mind, I would have said my pelvic floor was going to kind of squeeze up when I was breathing in and the
Mm.
opposite. And that's not logical when you explain it. And it makes perfect sense how it goes up and
Yeah.
down together. And I intuitively would have thought it was the opposite. So just
So
that awareness is great to have.
absolutely.
Yeah.
And Kelly, I love that you brought that up because you're not alone. A lot of women I see, whether it's virtually or in person, they have this, I don't know why, where it comes from, but there's this like feeling that when you breathe in, it's pulling in. I don't know if
Mhm.
it comes
Yeah.
from like when we were kids or teenagers and you're trying on skinny jeans and you're like, suck it in. And then you like suck it in, but it doesn't make sense because when you suck in air, your belly goes out. But we've been fighting ourselves, maybe.
Yeah. Well, and I
Yeah.
remember in one of my first yoga classes years and years ago when they were like, no, when you breathe in, your belly needs to expand. And I was like, no, it doesn't. It needs to suck in.
Yes.
Oh, right. See, so we're not like it's so interesting.
Yeah.
We were taught the
Yeah.
opposite.
Yeah, and that actually we call that in clinic paradoxal breathing, which is really fighting yourself, right? Like you're
Yeah.
trying to bring in air, you're trying to like bring this like nourishing air into your body, but you're restricting the flow because
Right. When you suck in your stomach, there's like not as much space
no,
for
there's
it to go. Yeah.
which I mean, we could have another episode on that. Like that would be like rib cage stiffness, mid back pain, like all this stuff. We won't talk about that today, but just
No.
know that when you inhale, if you really break it down logically, oh, like I have to expand my belly because air is filling my lungs. And then my pelvic floor should be opening and relaxing.
Well, as those changes
Yeah.
we just talked about, the increases and decrease of your pelvic floor, I can only imagine when you are pregnant and you are growing a child, there's less room in there as everything shifts. We've all been pregnant and things are happening inside. How does that impact it with all the less space that is happening for your pelvic floor, for your lungs, your diaphragm?
Yeah.
Everything gets smushed.
So, I mean, it's a beautiful, amazing thing when you're growing that being in you. And along with that comes the squishiness, right? So, depending on the position of the baby, how big the baby is, your body frame, there's a lot of factors there. But know that as you grow, you can still safely do things like breath work. Maybe at a certain point, you shouldn't be doing things like crunches or planks, right? And I don't know if we have time to get into that today, but I could break that down. But basically, you could just do this breath work to help keep things strong inside, but also have awareness on how to relax and let go. Because when you're giving birth, when you're birthing your child, you actually don't want to fight yourself. Like when you're having a
Hmm.
contraction and when it's time to push, you don't want to fight yourself and like hold it, right? You want your pelvic floor to open. Another image I give clients is like when you're relaxed, when you're breathing and inhaling, picture your vagina is a flower and you like open the flower petals. So on your inhale, you're opening up the flower petals.
Yeah.
And
Do
most
you
people are
work
like,
with,
no, it's a bud. I can't open it.
yeah. No, that's amazing. Do you work with women like who are pregnant and like postpartum?
Yeah, I work with
Yeah.
all ages. Yeah, I've
Yeah.
even
Because
taught
I
this
can,
to a teenager who was like, but she's a high level hockey player, a lot of hip stuff. And I was like, you
yeah.
know what? I'm gonna do hip stuff too, but I want you to know about this. And she was like, it helped her back pain actually, because she was always tight.
Yeah. That's amazing. I can see too during birth. I mean, we've all given birth, and it's always, unless you really have a lot of practice in knowing how to intentionally like relax parts of your body, it's painful, it's uncomfortable. And so, yeah, when we're in pain, everything wants to like clench up,
Yep.
which is not conducive to speeding up the birthing process.
Yeah. And I like that
And
you brought up pain, because I think as human beings, and we just don't like pain. Nobody likes
Mm-mm.
pain. But when you train yourself to get comfortable and sit with it, it's not as bad as what your brain is perceiving or interpreting. So that's like
Mhm.
mindfulness practice. And then, like I can use myself as an example. When I gave birth to my first child, I was a new physiotherapist. So I hadn't done all my inner core training yet. And I was fighting myself. Like I went from 4 centimeters to 5 in 7 hours. It was terrible because I was like holding every contraction I was holding. I wasn't like that connected and aware of
Yeah.
my core. And then with my second and third, they came out like bullets.
Yeah.
A little bit
Sounds so
scary
much
for my
better than
husband.
7 hours.
But it's painful. There's no doubt about that. But there is a way to breathe through it. And if you practice all those months before labor, you're just setting yourself up for as smooth as possible. Things can go wrong. You might need a C-section. That's okay too. You can
Yeah.
still train your inner core if it gets cut, but if you can prep yourself as much as you can, like, why wouldn't you, right?
So could
Yeah.
you walk us through? So how do you relax your inner core? Right? We've just kind of felt it breathing in and out. Do you just think relax? What do you do?
It's really hard to just think relax.
Yeah,
Um,
like that's
right?
inner core.
So the first thing, and we did it, but let's do it again. It's really just slowing down the breath and giving yourself time to feel your body. So most people, I just ask them to, take an hour, every hour of their day, just check in with your breath. And, whether that's just lying down, sitting, standing, one hand on heart, one hand on belly, or not, it's just an opportunity to feel like, am I even breathing fully? Meaning, when you inhale, there's a rise in the belly a little bit. Then your rib cage expands. Then your chest puffs a little. And then as you exhale, the chest softens down a little bit. The rib cage is kind of accordion in, right? They soften in. And then your belly softens in. And then once you feel your 3-part breath, so let's pretend everyone's got their 3-part breath. We're going to focus on the inhale. Okay, don't worry about your exhale. Whatever happens, happens. But on your inhale, you're going to bloom that vagina. So when you inhale, your flower petals are opening. If you're sitting, pretend your vagina flower is like on your chair. You're opening those petals onto the chair. I also like to talk about the back, right? Don't forget the back. So if you had a coffee bean and it's in your bum, I know it sounds weird, but just bear with me for a sec. If you had a coffee bean and it's way up in your bum, when you inhale, you're so relaxed, it just might roll out. You're not pushing it out though. It's not a forceful push. It's just like a bloop, might fall out. So every inhale, we're really visualizing this relaxed pelvic floor. And the corset is expanding on your inhale, right? And your rib cage is expanding on your inhale. And then when you exhale, everything might draw in a bit, but it shouldn't be like sucking all the way back in. But if it does, that's okay. That's an indication that maybe you tend to be more tight, which I think we're going to touch on next.
That was great. And that was perfect to my next question. So you're talking to moms who've had babies, and a lot of women have the issue with after you have a child, you tend to use the restroom on yourself, right? A little bit of leak comes out, whether you're sneezing, different things happen. You've just lost that ability to really
Yeah.
control it like you want. And when you say relax, that is a little terrifying sometimes, because if you're already having issues, what's going to happen if I relax? And a
Right.
lot of moms, myself included, you kind of keep that squeezed a lot because you're trying to compensate. So
Yeah.
how does this relaxing work if you're suffering, with that
Totally.
issue after having a child?
Great question. I was a victim to it too. I hear it a lot. I can't jump. I can't go on the trampoline with my kids. If my bladder's full and I sneeze, I'm done. I got to go change my underwear,
Yes.
right? So why are we talking so much about relaxing is because honestly, in my experience, and I know other practitioners that have the same, most postpartum moms are so terrified, like you said, Kelly, that they're squeezing all the time. So I'm going to give you an example. If I have my arm always curled up, like imagine if you're listening and not watching, but just picture, like the bicep curl, and you're squeezing that elbow all day long to curl your bicep, at the end of the day, it's going to be really hard to open your elbow. It's going to be really sticky, stiff, sore to open your elbow straight. That bicep is going to be too tight. And as a physio or a health coach, whatever, I'm not going to give that person bicep curls. They can't open their elbow to pick up the weight.
Yeah.
Right? You know what I mean?
Yeah.
Same goes for this group of muscles. Like if your inner core, if your pelvic floor is already tight, and your bladder fills up and your bladder's pushing, right, on your pelvic floor muscles because it's filling up, but you got no more room to squeeze. The range of motion is not there. That's really honestly, I don't know the exact percentage, but like 90%, let's say,
Yeah.
of people who like have incontinence, it's because they're too tight.
I
So
really
in that,
like the range of motion idea. Like you have to practice like the release and contract to build the muscle to make it stronger. Like your biceps not going to get stronger by just holding it.
exactly, and it's so not functional,
Yeah.
right? Yeah.
And this concept blew my mind. So I attended one of your free workshops a few weeks ago. And I know I messaged you afterwards about it because in my head it was tighten, tighten, tighten. And having to sit there and visualize relaxing. And I did it, I want to say I maybe did it for 5 minutes a couple times a day. And I'm still trying to remember. I already feel better and more supported from just doing it. And it went against everything that I thought I should do. And I also was just very afraid that I was going to use the bathroom on myself trying to do it the first couple times. I mean, it just feels so unnatural.
Yeah.
And it is mind blowing how simple something like that could be. And that's
Yeah.
it's not a simple thing to do, but just to know that
Yeah.
you have to
Yeah.
relax to strengthen.
Isn't that so cool? Like, I love hearing that. And I hear this a lot. And it just, every time it just puts this big smile on my face because it's not about doing 100 crunches or like all these planks. Like, I had this one
Yeah.
client who was so upset because I think like someone at the grocery store, a mailman or something, was like, "Oh, are you pregnant again?" And she's like, "No." Like, she just like looked pregnant because she had no idea about her core set muscle and her inner core stuff. And just by giving her the breath work, she was like flat tummied in 2 weeks. Like, so cool.
Yeah.
And also not peeing her pants, but like
Yeah.
Kate was like, I don't want
Added bonus.
Yes.
Oh, it's so amazing. I feel like I've been incorporating more breath work and I've been working with a wonderful Pilates instructor that's been doing lots of breathing and very gentle, intentional, movements and that kind of thing.
Wonderful.
And so much of what like my realization has been is like I was mostly just not aware of what my body was doing like 95% of the day. Like I just kind of like I have the baby on my hip and then I wonder like why that side of my body is so, out of whack. And, people are like who know look and they're like, oh, that's really imbalanced. Do you carry your child on that side? Do you carry the diaper bag and the car seat and all this stuff on that side? And I was like, uh-huh. And
Yeah.
just bringing awareness to like what is your body doing all day? And
Yeah.
then how do you bring more attention to these like to all
Yeah.
these parts that can have such an impact when really it's like it's just learning how to pay attention. It's amazing.
Yeah. And I think it's great that you work with some. Like I think that a lot of moms feel like we got to figure it all out ourselves,
Hmm.
like let's just do it all. And like you're so busy taking care of your family, your children, your maybe elderly parents. I don't know. There's just like so many hats moms wear and it's like really nice to have someone hold your hand and like guide you and be there to be accountable for and support you and like the mentorship. Like I don't think, I think a lot of I hope that this isn't true anymore, but like I feel like there's this like guilt of like I can't, I don't keep my house clean or like I don't have my body back to where it was. And like it's like you're doing so
Yeah.
much as a mom. Like, it's okay to lean on others for support, including like reconnecting to your body. Like, that's not an easy thing to do. So even though it's like, oh my gosh, yeah, like I always carry my kid on my left hip, because I'm freeing up my right hand. But like, you did that because you're just trying to make dinner. And like for
Yeah.
someone to point that out and like help you, like give you stretches and exercises to like rebalance that, like that's awesome. Right?
It is. And thank you for doing this. So if there's a mom listening who maybe only has 30 minutes of a free time while she's trying to cook dinner with the child on her hip, getting to hear someone remind her these are breath awareness things that you can do and how to start thinking through
Yeah.
relaxation and awareness of your muscles is a great thing for people to realize and to hear and to
Yeah,
get that first step.
totally.
Yeah.
So let me ask this. So all of us have had kids kind of fairly recently. None of our children are really that old. I mean, they're all not teenagers yet. What about if it's a mom who has kids 10 years ago, 12 years ago, 20 years ago? Does inner core support and strengthening still help them? Or is there a point where you're just like, well, that was too late?
That's never a thing. It's never too late. I have so many clients in their 50s and 60s, and they are just, they want to live independent lives. Like they don't want to, maybe they came in for like, you know what, my balance is really poor and I want to like make sure I can like keep up with my farm, or they're like, I can't live with this kind of back pain for like my retirement. I want to have like fun in my life. And then we
Mhm.
dig a little deeper and it's like inner core stuff. And they're like, oh, I just always thought, since having babies, like I'm always going to do this, like pee my pants or whatever. Right.
Mhm.
But then they do the work. They do they see me, they do the work, their homework, and they're like so amazed. And they're like, why didn't I do this like postpartum, like earlier? So I love that we're having this conversation, bringing awareness. Like I think it was so taboo, like, 10, 20 years ago, maybe. There's so much more awareness for women's health. And I just hope that we can keep spreading that, because there's no reason that as a mom, you need to like suffer through that. There's actually things you can do. And it's like Kelly said, as simple as paying a little bit of attention to your breath, mind body connecting
Yeah.
to muscles that maybe you didn't know you had.
Tatiana, is
Yeah.
there anything else that we can visualize or that if a mom who's listening today could do? So we've got the 3-part breath work, right? So we talked about spending a couple minutes once an hour, feeling your breath in and out from the parts of the muscles, and then adding in your pelvic floor and
Mhm.
kind of working on that. Is there anything for that awareness or kind of an exercise that you would recommend that a mom also try?
Um, so, and I think we'll include it in the show notes, but there's something I call XYZ spine, which is movement for your spine in 3D. So most of us either, even if you're a mom, like you just do a lot forward, breastfeeding, carrying, computer work, phone, everything is like in this plane. And I'm going to do it with you guys because we're watching.
Yeah.
But if you're listening, I'll also explain it so that you can follow along. So we're going to stand up and I'm going to show you guys, and you guys can do it with me if you want, Kelly and Ashley, what I mean by XYZ spine. So if we just stand nice and tall, I'll show you my profile view. We're going to do X spine first. So we're going to roll chin to chest, roll our body forward. Nice and gentle. You can bend your knees if you feel a little tight in the legs. And then you're just going to slowly ragdoll up. Maybe put your hands on your bum and push your hips forward for a back bend. We're going to do that one more time. This is the X axis for our spine. Make sure you're breathing. Okay, that was X. Now we're going to do Y. So right ear to shoulder, right shoulder to right hip. You're just side bending. And then if it feels good, you can even lift your arm and kind of open up through the rib cage. We spend so much time using our arms, hunching forward, breastfeeding, carrying, like this can get really tight.
Yeah.
Computer. Right? This is your Y. So we're just side bending for those who are listening and not watching. We're doing a side bend, so a direct side bend. And then the last movement your spine craves is Z, or I like to call it also rotation. And it seems, again, quite simple, but the amount of time we spend in this plane of axis is way more than those other ones. So just to mindfully do that even 3 times a day is going to make your back so much happier. Because I know a lot of moms get really stiff back, you know, like the breastfeeding pillow, sitting in a rocking chair. Maybe you have a baby that you're bouncing because they won't sleep. Yeah, and it's just like your spine is 24 bones and it's more than 50 joints. And it's just craving movement. It wants fluid to flow, the synovial fluid, the joint fluid needs to flow, the muscles around the spine, your blood, like it just is craving gliding and movement. And then when we don't do it, we get stiff and sore. And then when we get stiff and sore, it just cascades into, oh, I'm afraid to move because I'm stiff and sore. But then that's like, it just perpetuates.
Yeah. And Tatiana, some of this too, in a way, can almost be like preventative, like as we age, like if we're starting to move our bodies this way, because I think a lot of moms, it's like, well, there's nothing wrong. Like I can't point to a problem, so I don't need to seek out X, Y, and Z, right? Like I can't say that there's this one thing wrong, so I guess everything is fine. But there are so many practices and things that are out there that are supportive and preventative.
Yes.
And
I feel
like that,
you're in my head. So there's a quote I saw, which like really resonates with my passion. And it was like, prevention is superior to any cure. And it's true. Like I've been telling people this since like maybe like early in my physio practice, like don't wait till you're in pain. Like you feel a little tweak or like something's off. You don't need to know exactly, just come. Like as a physiotherapist, like we also really want to help people prevent injury. And then now that I'm in this like mind body health coach space, like that's what I really want to put out there. It's what I like post about on social media and like educate people through my emails. Is like, why would we wait till we're like old, stiff, and sore? Like, don't do that. We can do stuff now. And it doesn't have to be hours at the gym. It doesn't have to look like, you know, I go to 5 yoga classes a week and I do this and I do that. It can be like small bite-sized little pieces, but daily and consistent practice is important.
yeah.
That makes so much sense. And I can even feel my own back from just doing the XYZ. I sit a lot and hold a child and just moving the way we were built to move. I can feel that I don't do that very often.
We are,
as I should.
Totally built to move.
Yep.
Tatiana, this has been absolutely wonderful. I hope moms who are listening got a couple of different things that they can visualize and work on for their body. And if anybody is interested, how do they get in touch with you or learn more about your practice?
They can reach out anytime. I'm on Instagram, Tatianna Graham Inc. I'm on LinkedIn, Tatianna Graham. I'm in the Thrive community, so you can find me there. I love hanging with these gals. And I think, if you want to download my free guide, I think we'll attach a link somewhere. Yeah,
wonderful.
I'm happy to just chat like with anyone who's like interested in preventative health, or if you have inner core questions. Like I love this stuff. So please reach out.
Wonderful. And we will, in the show notes, we are going to include the XYZ spine stuff that you talked about, your free download, all your social media links, also ways to find Tatiana as a member within the Thrive platform community. Join us there as well to learn more from her. And we thank you guys very much for being here. Ashley, what else?
Yeah. I think that's it. I loved this. I learned so many things that, like Kelly said, are just, it should be intuitive. And maybe now that I do it, it's like, oh, it feels intuitive. But for whatever reason, my brain was like, no, it needs to be the opposite. And I think the more people in general can be in touch with their bodies and just aware and be more intentional about what they do every day, it's nothing but positive impacts. So thank you for all that you do. It's wonderful.
Thank you guys so much for having me. It's been a lovely, I love this. This is great.
Wonderful. Well, thank you guys, and we will see you next week.
Wow, Kelly, I learned so much from Tatianna. I think the information that she is sharing and the way that she's helping all of her patients is just really amazing. I think one of the biggest takeaways for me is reminding all the moms out there, myself included, that nothing necessarily has to be wrong to seek out services from physiotherapists or other practitioners like Tatianna. When, you're kind of coming into your postpartum body and things are getting back into place, so much of these movements and exercises can be preventative and just kind of helping rebuild your strength. It's just not something, like she said, you don't have to do it alone.
Completely agree. And I do think, looking back to our parents' generation, I do feel like that was a thing where people just said, I now have incontinence when I sneeze. This is just
Mhm.
what happens to you after childbirth. And it doesn't have to be. And just going through some of the mind body exercises that she did, I can feel a difference. And so just the little bit has helped me. I just am very impressed. And I hope that this is something that's helpful to all you guys listening.
Yeah.
So definitely, if you're interested, you want to check out more of her workshops, feel free to go to her website, or you can also check her out as an expert within the Thrive platform. And thank you for joining this week. We hope you got some great information, and we will see you back here next week. Thanks.
Thanks.
If you enjoyed this episode and found it helpful, please be sure to hit subscribe, leave us your feedback, and give us a 5-star review. For even more support, visit us at wethrivepostpartum.com/podcast to sign up for our newsletter and learn more about our community. Remember, you are not alone. With support, you can feel better. Together, let's thrive postpartum.